Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you for another discussion, this time around for case number 29. And before we begin, I'd like to ask you to join us in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. We've increased that to 300 this year and for the coming year. And to help us achieve this, just watch and finish the ads in our videos. And if you share this video to at least 10 of your friends, we're going to pray for your success. And thank you for doing that in advance. Now, I'd like also to make this public advisory. Dr. Ray Gapuz, that's me, and the mentors of the Ray A. Gapuz review system are not in any way connected to another center named Gapuz Review or Gapuz Review Academy. Okay, so on to our case number 29. We're going to talk about seasonal affective disorder, very timely. But before we do so, let me first congratulate a brilliant nurse from the University of the Philippines, Manila, Mary Abigail Dirillo, USRN, for passing the New York Board of Nursing last December 4, 2024. And she is an 85er, a certified 85er. That's the elite group of the Ray Gapuz review system passers who shut down the NCLEX at the minimum number of 85 items. Now, let's learn from her success story. I passed the NCLEX. Thank you so much to everyone who has supported my journey. My first thanks go out to Sir Ray. Thank you, who believed in me way before I even decided to take the exam. Your tremendous guidance and support has led me to where I am now and will continue to guide me in the future. To Miss McLean for the random consultations and batuhan ng questions sa office while working. To Miss Joan, who was so convinced I could pass even without studying. Nag-aral pa rin ako. Hehaha. To Angela and Josh for laughing with me throughout this whole ordeal. 3 out of 3 na tayong USRN. Yay! Yeah, all of them passed. To my other mentors, Madams Chair, Nicole, Marisol, Shans, Missy, and Tharlene, thank you for imparting your knowledge and for the advice you have all given me. During my review, what helped me the most was the comprehensive review, the bootcamp, and NCLEX 311. Quick fix. Hindi pwedeng puro basa lang. Pag nag-prepare sa NCLEX, dapat laging sabayan ng practice exams. The exams we used during the bootcamp and quick fix were sufficient to further ingrain the concepts into my brain. 2 weeks before my exam, I scanned through the basic concepts of each topic and reviewed my notes from the quick fix. I also took exams in the QBank related to the topic I was studying that day. The day before my exam, I went through the whole NCLEX 311 book just to polish everything. I felt slightly anxious when I took the exam, but I left the exam room feeling confident. I shut down at 85 items exactly 2 hours in. Excellent, Abby. My advice to those who are taking the exam, repetition and consistency is the key to mastering the concepts. Make time for studying each day. That's a very important ingredient. Make time for studying each day. 10 minutes of study is better than 0 minutes. Lastly, don't memorize the questions. Practice your critical thinking. That's the way to do it, okay? And of course, finally, she says, thank you, Lord, for guiding me every step of the way. Now signing in, Mary Abigail Dirillo, USRN from the University of the Philippines, Manila. Congratulations, Abby. I'm so happy. And I know soon your other colleagues from UP will also pass the test through our system. Now, we also have another thank you note from Abby because she utilized our ITAPS processing services. In order to focus on my review, I decided to utilize the processing service of ITAPS. No regrets. Mom Faith was so easy to work with, and she answered all my questions regarding the processing with patients. I feel I was able to focus on my review without feeling worried about whether my application was proceeding as it should. Mag-message na lang si Ma'am Faith if may progress na. Thank you so much, ITAPS, and more power. That's the way to do it. Focus on your review and pay particular attention to these services that you can avail of from the Ray Gapuz review system, and that is from the time you decide to apply for your NCLEX We process your NCLEX application faster and at a cheaper rate. And now we have a promo. What does that mean? If you process your application through iTaps, you get a free review for the NCLEX RN. So get a free review from us if you process your NCLEX RN application with iTaps Gapuz. Now, on to what we're going to talk about today, seasonal affective disorder. Now, pay particular attention to the fact that seasonal affective disorder, as the term implies, occurs depending on the season of the year. So, the outstanding feature of this condition is the fact that the duration would usually last around 4 to 5 months or approximately 6 months. And you have what we term fall and winter seasonal affective disorder and spring and summer seasonal affective disorder. So it does not necessarily mean that when you say seasonal affective disorder, it only occurs during winter or fall. It can also occur during spring and summer. Now, what are the similarities and differences? Definitely, the similarities would be the onset of the symptoms could be related to the change in the season. And of course, there are symptoms that are specific to each of these subtypes. Okay? So, for fall and winter seasonal affective disorder, you would usually see the client oversleeping, and then they would usually have craving for foods that are high in carbohydrates that ultimately leads to weight gain and eventually low energy levels. So that's how they are. Now, for clients having spring and summer seasonal affective disorder, the reverse occurs. So instead of oversleeping, they will have difficulty sleeping, they will have insomnia. Instead of increased appetite, they will have poor appetite. And instead of weight gain, they will have weight loss. And eventually, they will have behavioral problems like irritability. Therefore, if you get to see a client whose sleep patterns as well as whose mood could be related to the change in the season, you might as well advise that person to seek consult. They could be suffering from seasonal affective disorder. So, seasonal affective disorder is a type of depression that occurs at specific times of the year, often, but not exclusively, in the fall or winter. But as we said a while back, we also have seasonal affective disorder that occurs during summer or springtime. Okay? Now, the primary cause of fall or winter seasonal affective disorder would be due to reduced sunlight exposure. And this usually happens in North America, specifically Canada, where the weather is a little gloomy during winter. Now, what are the signs of seasonal affective disorder? Now remember, SAD. S, social withdrawal and sleep disturbance. It could be hypersomnia or insomnia, depending on the season. Anhedonia, or lack of interest in things that usually brings joy or pleasure. And of course, depression that is affected by the change in the season. Now, when a client has seasonal affective disorder, the priority intervention is light therapy. But let's apply that into the layman's understanding of what light therapy entails. Usually, you just have to advise the client that if the weather is gloomy, they need to turn on the bright lights in the house. So turn on the lights all over the house so that their mood could at least be heightened by the bright environment. Now, this usually involves exposure to bright light that mimics natural sunlight to help regulate the body's internal clock and improve mood. Now, discharge instructions on related to seasonal affective disorder clients would be, remember, blames. Okay, balanced diet. They should have enough carbohydrates, balanced with fats and protein. Light therapy, antidepressants if there's a need to. So they should be given antidepressants, and they should be told that antidepressants would usually take time before it works. Initial effects usually occur in 2 to 3 weeks, and the full therapeutic effects occur in 3 to 4 weeks. And pay particular attention to the fact that if your client is taking an antidepressant, there are at least 4 adverse effects that you will need to focus on. Like, for example, if they're taking selective serotonin reuptake inhibitors, they can have serotonin toxicity manifested by muscle rigidity, fever, seizures. Okay, and these things need to be reported to the healthcare provider because they need to either adjust the dose or stop the medication and change it. And then the client should maintain a routine sleep schedule to prevent insomnia or hypersomnia. They need to exercise. And the most important thing, since this is about depression, they need to seek social support from friends, relatives, and family. Okay? Now, before we move on and use what we just discussed to answer a case, allow me to share with you the good feedback, of course, not because I'm the author of the book, NCLEX RN 311, but I asked a recent passer, which book helped you the most? And this is what she says, 311 po na the new edition, the next generation quick fix edition, parang kopya, ha ha ha. And then somebody, Irie Valerie Gillian, commented on that post, totoo po ito, parang copy-paste, na-reword lang yung mga iba. I'm not the one saying, it's not because I'm the author, but thank you so very much for your trust in my book. That book is a product of my more than 30 years of experience focusing on test preparations programs for the NCLEX RN, and I can lay claim to the fact that no one else in the world has monitored the NCLEX the way we did at the Ray Gapuz system for the past 32 years. So here we go. Let's apply what we learned to a case study. A 34-year-old woman presents with symptoms of depression, fatigue, and social withdrawal. You have 2 of those main symptoms in our acrostic SAD. You have social withdrawal and then depression. Every winter for the past 3 years. That's a key phrase there. Every winter. So this becomes now part of what is expected when winter comes. And for those countries in which they will have winter for more than 4 months, chances are this is going to be seasonal affective disorder. With her symptoms improving during the spring and summer, okay, which is the most probable diagnosis of the client. Now, this can't be major depressive disorder because usually major depressive disorder will not last for several months. Usually, okay, this is not bipolar disorder because we don't have a manic state or a hypomanic state. And although depression and loss of energy are symptoms that could be similar for clients with seasonal affective disorder and chronic fatigue syndrome, usually in chronic fatigue syndrome, the symptoms would last more than 4 to 5 months. So the best answer for this situation would be number 3, seasonal affective disorder. Okay, I just hope you enjoyed this case, and I'd like to ask everyone to join our hundreds and thousands of pastors from all around the world, from 36 countries and counting, who believe in the Ray Gapuz system, because here our technology is anchored on world-class learning tools. Plus, we have our own learning management system that covers all the subjects in the test, and there's something that we have that they don't. Our learning management system is being updated on a monthly basis. Plus, we have a very conducive environment where we keep the class size to a minimum, and we have our own simulation room for our next generation NCLEX RN simulation. So I'd like to invite you actually to join me in my next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, our QBank and my 3 books, plus NGN strategies and sample questions, and of course, our quick fix session. Our fee starts at $3,499, inclusive of my 3 books. I'll see you around in my next video. And for those who are taking the test anytime soon, good luck. Once again, this is your mentor, your fact check buddy Ray Gapuz, saying, just trust yourself and let God do the rest. I'll see you in my next video. Take care.